my name is Rebecca Skinner and this is Complementary and Alternative Therapies in Rehabilitation. Complementary therapies are something which is used alongside traditional veterinary medicine, while alternative therapies are used instead of. They're used for a variety of reasons, including the influence of internet and social media, money, as they are quite often cheaper than the traditional veterinary treatment, and the will to believe when traditional treatment hasn't worked. Unfortunately, many have little research backing and are based entirely on anecdote. This is Johnny, our case study horse. He is a 19-year-old thoroughbred and previously worked up to novice level dressage before coming to the college. As can be seen in the image, Johnny has extremely lordotic posture, is very undeveloped, and his conformation is not ideal. He's previously suffered a fracture to the right carpus and has recently had a severe abscess erupting from mid-cannon in the left forelimb. So, risk factors for injury. Indicators of pain or injury can encompass several things, one of which is reduced performance. A reduction in performance, particularly difficulty in higher level movements, may indicate dysfunction or discomfort. Behavioural changes are also implicated, such as the horse seeming unwilling to work or showing negative association to certain tasks or their tack. Or the horse may just appear generally depressed. Facial expression has more recently been used in ethograms as a method for identifying lameness. Kinematics can also be used as a method for identifying pain. Pain may be seen to reduce range of motion or increase stance time in order to reduce forces. Thoracolumbar kinematics have also been thought to alter with back pain, with the reduced range of motion being linked to lameness. Muscular asymmetry or atrophy may indicate pain or dysfunction in a certain area, while a consistent saddle slip has been linked to hind limb lameness. A visible lameness or gait abnormality would be the most obvious indicator. However, once the lameness is visible, it is likely that pain is to have developed from a more discreet source. So, the first risk factor we'll be discussing is discipline. It's widely recognised that different disciplines place different athletic demands on the horse, resulting in differences in injury prevalence, especially among elite horses. In dressage, the most common injury in both elite and non-elite horses is the hind suspensory ligament, followed by the tarsus in elite horses and the navicular bone in non-elite horses. This is thought to be due to the fact that in dressage, the horse is required to shift weight to the hind limb and be lighter on the forehand, promoting the hind limb to injury. In show jumping, the most common injury site is the suspensory ligament and the deep digital flexor tendon in elite horses, while in non-elite horses, the navicular bone and supporting ligaments are the most common injury site. These horses are most likely to injure the forelimb due to the forces experienced when landing from a fence and also the rotational forces experienced during a tight turn. In eventing, the injuries are similar to that of show jumping horses and also are likely to be due to the forces occurred landing from show jumping and cross-country fences. The suspensory ligament and the navicular bone are the most frequent injury site for both elite and non-elite eventers, although in the elite horse there were 6 times more superficial digital flexor tendon injuries compared with non-elite. Training and fitness has also been linked with injury risk. If training is inadequate for the desired performance of the horse, then injury risk is increased as the tissues are not adapted to the demands of the sport. Training should also be suitable for the horse's current fitness level. If training surpasses fitness too far, then the horse is likely to fatigue, therefore increasing injury risk. The training should also allow adequate rest days to allow tissue repair from microdamage and to decrease the chances of fatigue. Murray et al. 2010. Conformation has also been implicated as a risk factor for injury. It It is thought that both static and dynamic conformation could potentially influence injury development, however there is little evidence to support this. Foot conformation has been seen to affect career longevity, with horses with asymmetrical feet having been seen to have shorter competitive careers, by et al. 2009. However, it is important to realise that static conformation does not necessarily predict dynamic conformation and the influence this may have on performance or injury risk. The effects of both static and dynamic conformation and their influence on lameness require further investigation, especially factors which may affect balance. Surfaces are another factor implicated in injury risk. Man-made arena surfaces are commonly used in both training and competition of horses. Up until recently, research into their effects on performance and injury was lacking. However, this has been becoming a more popular research topic. Surface properties have been seen to affect on the stresses and strains experienced by the horse during work. However, it is important to consider the requirements of individual disciplines. Maintenance of the surface has been implicated as a very important factor in injury risk, with rough, uneven surfaces resulting in irregular forces acting on the horse's limbs, which would increase the risk of injury. Sand surfaces have been seen to have a higher incidence of tripping, while wood chip surfaces have been seen to have 12.7 times more chance of slipping. It's thought that tissues become less prone to injury the more a horse trains on the surface. Therefore, training should occur on surfaces which the horse is likely to compete on. Murray et al. 2010. Tack fit has also been implicated in injury risk. Traditional bridle design positions parts of the bridle over anatomical and prominences and moving parts of the head, with excessive noseband pressures having been raised as a potential issue in regards to welfare and performance and injury. Murray et al. 2015. The saddle should fit both the horse and the rider, enabling them to remain in balance throughout a variety of paces and movements. Poor saddle fit has been associated with back pain due to asymmetrical loading and muscle activation. When a poorly fitting saddle increases the total force applied to the horse's back and results in areas of increased pressure, it is also possible that this may increase activity in the epaxial muscles. Professional saddle fitting has been seen to have a positive association with thoracolumbar dimension changes, while the prevalence of ill-fitting saddles has recently been highlighted, with most saddles in sports horses having some variety of ill fit. Grieve and Dyson 2013. Age is another risk factor for injury, with the age group 10 to 15 and 15 plus years having been deemed the highest risk of developing orthopaedic injury. Lameness has also been seen to be more likely in the old horse due to the accumulation of microdamage or degenerative changes associated with age. The final risk factor we'll be discussing is the rider. On average, the net vertical force on the back of the horse is equal to the body weight of the rider. Therefore, increases in rider weight and the forces applied to the horse's back, but also the loading experienced by the limbs, and this also is thought to shift the centre of mass forwards. Variation in rider technique is thought to be seen in the variation of force pattern around the average value. It's thought that an unskilled rider may influence thoracolumbar biomechanics negatively, causing hollowing of the back, loss of core strength, and possibly contributing to back pain. In contrast, it is thought that skilled riders can alter the horse's way of going in ways that may mask the degree of lameness or pain. This may lead to the progression of injury before it becomes apparent. However, it is thought that the skilled rider should be more capable of picking up on signs of pain or discomfort. Ticock et al. 2010, Grieve and Dyson 2013. In terms of the case study horse, Johnny was out of work at the time of the case study, so discipline was unlikely to have any influence on injury risk. Due to his prolonged periods of being out of work or in very minimal work, his fitness was minimal and therefore would have made him likely to fatigue. However, due to his lameness, the workload was not high enough for this to occur. He was also very weak due to prolonged time out of work, which may have predisposed to injury should any of his exercise have been too strenuous. Johnny had quite poor conformation, which could increase asymmetrical loading, therefore increasing injury risk when he returns to work. Johnny was only working on a sand surface due to his lameness, which has been identified as a higher risk surface. However, it's likely, as this is the only surface he was working on, that his muscles would have adapted. Tack fit could have been one of the larger risk factors for Johnny, as it was identified that his bridle was too small and his bit too big. Johnny was not under saddle at this point, however it was thought to be a potential previous issue. Johnny's age would also put him at higher risk of developing orthopaedic injury. So, moving on to the physiological and neurological aspects of injury. Nociceptive pain is pain which arises from physical tissue damage, while neuropathic pain is pain which is arising from damage to the nervous system. Other pain is pain which arises from neurological dysfunction rather than damage. When tissue damage occurs, there is a localised neurophysical response. The neurological aspect of this response is how the nervous system responds to injury, and the physiological aspect is how the body's physical mechanisms respond to injury. Pain receptors in the skin are activated by tissue damage. A pain signal then travels up the peripheral nerves to the spinal cord. Within the spinal cord, neurotransmitters are released. Neurotransmitters activate other nerves which pass signals to the brain. In the brain, the thalamus relays the signals onto the somatosensory cortex, frontal cortex, and the limbic system. The physiological aspects of pain. Pain induction significantly elevates sympathetic nervous system activity, which is often marked by increased anxiety and heart rate. The body's response to pain involves physiological changes which can be useful and potentially life-saving in severe injury. These responses include an increased heart rate, fluid retention, increased breathing rate, shallow breathing, activation of the HPA axis, increased blood glucose, increased cortisol production, reduced gastric emptying, muscle tension, adaptation to pain processing, and anxiety. The sympathetic nervous system stimulates brain stem cells that control descending pain mechanisms to release noradrenaline, serotonin, and endogenous opioids into the dorsal horn of the spinal cord. The sympathetic nervous system is also concerned with the regulation of vascular tone, blood flow, and blood pressure. Pain therefore increases heart rate, blood pressure, and respiratory rate. The sympathetic nervous system also has an inhibitory effect on the digestive system, allowing the body's mechanisms to focus on other areas. Swift 2018. Neuromotor control is the coordination of the muscular system by the nervous system. It is responsible for the production or resistance of movement. Proprioceptive input from the periphery is processed by the central nervous system to produce muscle contraction as well as the timing of muscle recruitment. Locomotion in the athletic horse is powered by the muscles and their ability to generate force and power. The central nervous system receives sensory input from the periphery, including vestibular, visual, and nervous inputs. This input is used to control the timing of muscle recruitment, to provide effective control during locomotion, and prevent excessive locomotion about the joint, which could lead to tissue overload or injury. The sensory motor system is a subcomponent of the comprehensive motor control system. This is the sensory, motor, and central integration and processing components involved in maintaining joint homeostasis during locomotion. Mechanoreceptors responsible for proprioceptive input are primarily found in the muscle, tendon, ligament, joint capsule, skin, and fascia. Integration is the summation, gating, and modulation mechanisms that occur as a result of various combinations of excitatory and inhibitory synapses. Integration is an essential component of coordinated fluid motor control and occurs at all levels of the CNS. Most proprioceptive information travels to higher central nervous system levels through either the dorsolateral tracts or the spinocerebellar tracts. The motor components of the sensory motor system contributing to joint stability are synonymous with areas controlling whole body motor control. Ryman and Lephart, 2002. Pain is a complex biophysical phenomenon that arises from the interaction of multiple neuromotor and neurochemical systems with a number of cognitive and affective processes. In the presence of pain, the strategies used by the central nervous system to control muscles may be altered, leading to a less efficient muscle recruitment strategy. Morphological changes of muscles have been seen in human patients as a result of pain, which may lead to dysfunction. McGowan and Haitinen, 2017. So moving on to therapeutic techniques and exercises. Therapeutic exercise is a controlled exercise which is fundamental in most rehabilitation programs. However, there are few controlled studies in horses investigating the therapeutic effects of controlled exercise on musculoskeletal injuries. Before designing an appropriate rehab plan, a complete and accurate diagnosis is essential in order to avoid further damage to the injury. The ideal rehab program would be formulated to complement and enhance the healing process, while the basic principle is to reduce force and strain on the injury while allowing the normal repair process to proceed. Exercise programs should be adjusted throughout depending on the horse's progress and reactions. Davidson, 2016. One of the main points in a therapy program is physical therapies. Manual therapy procedures are dependent on the ability of the patient to relax and respond to the applied force. Hausler, 2016. Following the lead of human athletes, massage and physiotherapy is becoming commonplace in management, especially in the athletic or rehabilitation horse. Massage is thought to affect a number of physiological systems as well as cellular and facial components of the body. Massage uses a number of techniques first developed in humans and has been seen to reduce muscle tension and soreness, reduce muscle spasms, increase flexibility and range of motion, reducing nociceptor activity and decreasing stress responses. Scott and Swenson, 2009. Aerobic exercise is another important aspect of rehabilitation. Regular participation in aerobic exercise will help to decrease pain, maintain strength and joint function. However, this must be patient-specific and very individualised in the plan for injury. Paul Klaus and Hausler, 2009. School movements can also be used in rehabilitation with changes in direction, serpentines, figure eights, backing up, working around obstacles, all challenging balance. Transitions can be used through altering speed, stride length and cadence to help improve coordination and neuromotor control of the limbs. Transitions encourage the horse to step under the body and use the core muscles for self-carriage and balance. Paul Klaus and Hausler, 2009. Pull work is another modality which may be used in therapeutic exercise. Both ground and raised pulls are high-level neuromotor training exercise that facilitate abdominal and iliopsoas contraction. They can be used to improve tempo, improve interlimb coordination, and encourage lowering of the head and neck, relaxation of the pole muscula, and promote limb flexion and protraction. Pole work can also be used as a maze for the horse to walk through, which stimulates neuromotor control, proprioceptive awareness, and makes the horse focus on the task at hand. Paul Klaus and Hausler, 2009. Hydrotherapy is becoming increasingly used and is a commonly prescribed treatment option for managing primary musculoskeletal injuries and reducing or limiting compensatory gait abnormalities. This exercise is associated with increase in muscle strength and function, which also significantly improves proprioceptive deficits, poor motor control, and abnormal locomotor characteristics which are typically associated with joint dysfunction. Hydrotherapy is thought to reduce the mechanical stress applied to the limb, improve joint range of motion, decrease pain and inflammation, and improve muscle strength and cardiovascular endurance. King 2016. Walking in high water heights has, however, been seen to cause extension of the back and lifting of the head. This postural change should be considered when using hydrotherapy. Nankervis et al. 2015. Swimming can also be used to provide an environment where the horse is completely free from weight bearing. However, it does promote an unusual locomotor passion and severe extension of the spine. Palclas and Hauslet 2009. Groundwork is another beneficial tool in all training and rehab plans, with lunging having been seen to reduce lameness, which is thought to be due to increasing in proprioceptive awareness and muscle adaptation to different types of work. Long reining can also be used in straight lines, which is especially effective in rehab programs to avoid asymmetrical loading. Within groundwork, training aids are also commonly used. The Peugeot training aid is probably the most commonly used in training and rehabilitation. The Peugeot is thought to strengthen the back, engage the hindquarters, stretch top line, and encourage the horse to work correctly. Despite its widespread use in the industry, however, there is little evidence to support its use. From a rehab perspective, the Peugeot can also be used as a sensory tactile facilitation aid, with the hindquarter band providing a sensory cue to stimulate limb protraction and use of abdominal musculature. This method is used in other aids such as the Equiband and Equicore systems, and is commonly used to re-establish correct muscular activation and encourage normal locomotor patterns. Walker et al. 2013. Stretching and joint mobilisations are another physical therapy used as part of rehab. Stretching exercise offer affected tissues can be used to elongate contracted or fibrotic tissues and to improve soft tissue extensibility. Stretches can be either active or passive, with active stretching using the horse's own movements, whereas passive stretches are applied to relax tissue during mobilisation. Stretching should be performed slowly to maximise tissue elongation, with rapid stretching being thought to often overload the tissue's mechanical properties and potentially causing additional trauma within already injured tissues. Stretching should, however, be avoided in the inflammation phase of an injury, as this could further damage tissue. However, during the remodelling phase, it would be beneficial to aid in regain of the tensile strength. Joint mobilisations are characterised as non-impulsive, repetitive joint movements induced within the passive range of motion with the purpose of restoring a normal and symmetrical joint movement and to stretch surrounding connective tissues, whereas joint manipulation is a manual procedure involving directed impulse that moves a joint beyond its physiological range of motion but does not exceed the anatomic limits of the articulation. Manipulations and mobilisations are often used to test quality and quantity of movement in assessments as well as part of the rehab plan. Normal tissue repair and remodelling relies on mechanical stimulation of cells and tissues to restore functional properties, meaning that stretching and mobilisations are very useful without submitting the horse to physical exercise. Core exercises can also be used for the development of core muscle strength, which is important for performance and injury rehab in sports horses. It is thought that exercises involving stretching, strengthening and balance contribute to the prevention of injury and enhance rehabilitation. These exercises have been seen to increase the cross-sectional area of the multifidus muscle, which is thought to increase spinal stability also. Activity of the rectus abdominis and external abdominal oblique is positively correlated with hind limb protraction. Core exercises, therefore, are likely to help improve the horse's tracking distance. It has been seen that these exercises performed 3 times a week increased gait quality, which is considered to indicate abdominal strengthening. De Oliveira, 2015. Hill work can also be used to create abdominal contraction and strengthen muscles responsible for propulsion. It aids in bringing the hind limbs under the body and lifting the back. Walking downhill versus uphill requires deceleration of body mass, which requires greater neuromotor control, whereas backing uphill can also be used as a higher level proprioceptive activity, including novel muscle activity. Halklaus and Hausler, 2009. In terms of the case study, a variety of modalities were used, the main one being massage. This allowed stimulation of muscles as well as stretching and mobilisations, which all could be done within the box to allow him to continue box rest while also beginning to build up some strength and restore some range of motion to the joints. Cryotherapy was used early on in the rehab process to reduce swelling and inflammation in the lame limb. Further in the process, groundwork was introduced in the form of hand walking, simply to get the horse moving and start to build fitness. Pole work was later incorporated into this to encourage joint flexion and some more focus on the activity at hand. During groundwork, the equicore was often used as it was thought to help lift the back and stimulate protraction of the hind limb, both of which would have been useful for the case study horse. However, due to his personality, there was more adverse effects seen than there were positive effects. Late in the programme, we managed to introduce water treadmill work, which further increased fitness and encouraged flexion of the joints, as low water heights were used to encourage stepping over the water. Monitoring and measuring within the rehabilitation process. So monitoring and measuring is important as it gives objective measures rather than purely subjective. This increases accuracy of the process, with an initial assessment providing benchmark for process monitoring. Evaluating the responses to therapy is also vital so that the process can be adapted if needs be, providing a more informed rehab process with more measurable outcomes. One method of monitoring and measuring is gait analysis. This is the assessment of movement either objectively or subjectively, with the subjective measures including trotting up, backing up and circling, while the objective assessment uses video recording and biomechanics software. Inertial measurements units are also becoming common in gait analysis, however more so within lameness investigations. Lameness investigation consists partly of a subjective gait analysis and also of flexion tests and lunging. The quality of equine performance can be influenced by pain, whether or not it results in a visible lameness, and the ability of riders and trainers is to recognise and or acknowledge pain-related gait abnormalities appears to be limited, so this is an important investigative process. Measures of muscle and posture are very important, as postural assessment as part of the rehab plan is important, as poor posture can increase injury risk. Tabor et al. 2019 developed a new method of analysing thoracolumbar posture from still images using thoracolumbar angle. Muscular development can be assessed objectively, subjectively. However, images are useful for comparison. A flexi curve can be used to outline specific areas, particularly the thoracolumbar region. Comparisons of the outlines can show either improvement or atrophy of the area. Measuring pain is another important part of the process. Facial expression ethograms and composite ethograms to assess pain in both a stabled and ridden horse have been used successfully to differentiate between lame and non-lame horses in several research studies. The use of pressure algometry has potential to quantify clinical pain in horses as well as to evaluate treatment results. The pressure algometer is a tool used to test musculoskeletal responses by mechanical nociceptive thresholds. Therapies et al. 2010. Within the case study, several techniques were used. To assess pain, palpation and pressure algometry were both used to identify pain in both the back and the paw area of the horse. Pressure algometry was used throughout the case study and saw improvements towards the end, especially in the back. Thermography was also used in the case study, however, due to environmental variables and our lack of control of the horse's activities before our session, they were deemed to not be comparable to one another. Gait analysis and range of motion testing were also used throughout the case study, both objectively and subjectively. However, due to Johnny being lame at the beginning of the case study, this was not comparable to the measures taken once he was once again sound. There are several practitioners within the multidisciplinary team, and communication between the horse owner and a variety of practitioners is important when developing a rehab plan. Goff 2016. The vet is responsible for the original diagnosis. Once the owner has recognised an issue, veterinary consult should be the first port of call. An accurate diagnosis should be given by the vet before any therapy can begin. The vet is then also responsible for any medical care the animal may need, and in the long term, the vet is responsible for monitoring injury progress and adapting treatment if and when necessary. If the issue is surrounding feet, then the farrier may also be involved in the diagnostic process alongside the vet. The farrier's main role, however, is to maintain foot health and balance in order to support the horse's rehab programme. This may involve specialised shoeing or trimming, as it did within our case study with Johnny, who needed plated shoes and packing in order to become sound again. The dentist is responsible for regular care and maintenance of the teeth. Dentistry issues can lead to tension and pain around the head and poll and spreading to the rest of the body. This can greatly affect the horse's work and performance and may lead to secondary issues due to an adapted way of going. The physiotherapist and other therapists must take into account a veterinary diagnosis as well as a full clinical history of the horse and the owner's goals for the horse. From this, the therapist is responsible for developing a treatment plan to work alongside a veterinary treatment. The treatment plan should aim to eventually reach owner's goals, promote healing, maintain or improve performance, and not put the horse at any risk of further injury. Communication between all the practitioners in the team and the horse owner as well is extremely important, as what one person does or changes could affect the treatment that other people are trying to do. In terms of a final assessment of Johnny, he saw a vast reduction in swelling with the affected leg returning to normal and returned to soundness once he was shod once again. Once he was shod and returning sound, he could begin hand walking to begin to build his fitness. He increased his performance in groundwork, moving on to pole work, long lining and lunging, ready to build his fitness and muscle development before his eventual return to ridden work, hopefully sometime soon. Unfortunately, there were no visible improvements within his posture or within his muscular development. This was thought to be due to such long-term time on box rest or on very limited work that his muscular was so underdeveloped it would just take a much longer time period in order to improve. His posture is also a long-term issue which will hopefully improve with further muscular development. He also managed to start working on the water treadmill in order to increase his fitness, which was also seen to very effectively help increase his joint range of motion by using low water heights, encouraging him to step over the water rather than through it. There is the references. Thank you very much.